Hello everybody and welcome to my channel. I'm Mariah and today's topic is Rett Syndrome Awareness Month. In this video I'll cover everything about Rett Syndrome. This video is research based. For the research in this video I use one article to gather information for this topic. October is Rett Syndrome Awareness Month and the article I used was titled What is the Life Expectancy of a Person with Rett Syndrome? And this is from the eMedicine Health website. What is Rett syndrome? Rett syndrome is a rare genetic degenerative neurodevelopmental disorder seen predominantly in females. The condition affects the way the brain develops and can lead to problems with movement, coordination, and language. What are symptoms of Rett syndrome? There are 4 stages of Rett syndrome, and each stage has different symptoms. Stage 1. Developmental arrest, which is 6 to 18 months. Gross motor developmental delay, disinterest in play, loss of eye contact, low muscle tone, hand writhing, unusual calmness, breath holding spells, slowing of head growth, weight gain, and height gain. Other vague and non-specific early symptoms. Stage 2, rapid deterioration or regression, and that is 1 to 4 years. We have autistic-like behavior, stereotypic hand movements while awake, which is hand writhing, clapping, hand washing, or hand-to-mouth movements. Breathing problems, hyperventilation or breath holding, seizure and vacant spells that resemble seizures, sleep disorders, intermittent crossed eyes, and irritability. Stage 3, pseudo-stationary, which is 2 to 10 years. We have some improvement in behavior, hand use, and communication skills, good eye contact, and attempts to communicate intent. Increased mental impairment and hand stereotypes, increasing rigidity, tooth grinding, hyperventilation, breath holding, and involuntary tug movements. Motor dysfunction and seizures, continued breathing irregularities, deficient weight gain despite a good appetite, difficulty feeding, and some oral motor dysfunction, and scoliosis. Stage 4, which is late motor degeneration, I'm sorry if I said that wrong, which is over 10 years old. We have no additional deterioration, that's the word, of cognitive skills and communication skills or hand skills. Increased motor problems, muscle contraction and rigidity, muscle wasting, weakness in limbs, loss of ability to walk, possible reduction of seizures frequency, scoliosis or kyphoscoliosis, growth retardation or growth slowing, hyperventilation, improved frequency and intensity of hand motions, preserved eye contact. What causes Rett syndrome? Rett syndrome is a rare genetic disorder caused by mutations in MECP2 gene, which is located on the X chromosome. Women have 2 X chromosomes, and men have 1 X chromosome and 1 Y chromosome. Rett syndrome is due to a genetic mutation in a sperm cell or egg, de novo mutation, rather than an inherited genetic defect. In most cases, the defect comes from the father, which may explain why more females develop the condition than males. How is Rett syndrome diagnosed? A physical examination can often reveal characteristics of Rett syndrome. Some testing may need to be performed to confirm diagnosis. Lab testing may include genetic testing for parents who meet diagnostic criteria for Rett syndrome, blood lactate, ammonia, or pyruvate, I'm sorry if I said that wrong, and amino acids. Um, urinal, urinal organic acids and chromosomal studies include specific tests for Anglo-Man syndrome, which is chromosome 15, and urine tests for uroporphorin. I'm so sorry if I messed up that name. To rule out intermediate porphyria. Rarely helpful. Um, other studies may include barium swallow test or overnight PF probe study. We have imaging studies such as an MRI. We have an ECG, an EEG. We have psycho. I'm sorry about saying that. Let me restart that. It's neuropsychologic testing or auditory brain stem evoke responses, and then we have stomosensory evoke responses, and then we have a EMG. We have an ERG, and then we have a polygraphic respiratory recording, and then we have psychometric testing. I'm so sorry about all those tests and all those pronunciation issues. And what is a treatment for Rett syndrome? There is no medicines used to treat Rett syndrome, but some symptoms may be managed with medications such as we have anti-epileptic drugs or AEDs for epilepsy. We have drugs for gastroesophageal reflux disease or GERD. We have levocarnine, and then we have sedative hypotrix. Sorry, I think that's how you say it, and I'm so sorry if I messed up any of that. And then other therapies may be used for Rett syndrome, may be used to treat Rett syndrome include, we have vagal nerve stimulation, snoozolin, multi-sensory approach with or without hydrotherapy. We have gastrostomy tube. We have fundoplication if GERD does not respond to medications. We have surgical treatment of scoliosis if a condition does not respond to orthotics. A special diet may be indicated, such as we have high calorie diet with 17% of calories from fat, 15% from carbohydrates, 15% from proteins, and then we have a ketogenic diet, which is low carbs, high fat. We have a supplementation for osteoporosis, and I'm sorry if I said that wrong. We have vitamin D, calcium, and then bisphosphone. I'm not sure. Sulfonane. I don't know if that's right, and I'm sorry if it's wrong. What are complications of Rett syndrome? Complications of Rett syndrome include problems eating, which can lead to malnutrition. We have gastroesophageal reflux disease or GERD. We have sleep problems, seizures, scoliosis, and need for lifelong care, and then shortened life expectancy. What is the staging for Rett syndrome? Rett syndrome progresses through 4 stages as follows. Stage 1, developmental arrest, which is 6 to 18 months. Stage 2, rapid deterioration or regression, which is 1 to 4 years. Stage 3, pseudo-stationary, which is 2 to 10 years. And stage 4, late motor deterioration, which is age over 10. What is the life expectancy for Rett syndrome? The average rate of death for patients with Rett syndrome is about 24 years, and in most cases, death is sudden and secondary to pneumonia. Risk factors for sudden death include seizures, loss of mobility, trouble swallowing. With proper care, including nutrition along with physical and occupational therapies, patients can often survive into their 40s and or 50s, though with disability. I hope you enjoyed this video. As always, I'm open to any suggestions you have for any future video topics. Please let me know what they are in the comment section below or on my Twitter page. And my Twitter handle is @BurleyMariah, and I can spell it for you. @BurleyMariah. So that's my last name and then my first name. The next video will be on schizoid personality disorder. This topic was suggested to me. I hope you guys are continuing to stay safe. I'll post my notes in the comment section for anyone who needs them. Please like, share, and subscribe if you want to and found this video to be helpful. Feel free to share this video with anyone you think might need it. If you want to be notified for when I do any live streams or upload any new content, you're going to hit the bell icon. And under the bell icon, you're going to want to select the all options. Thank you for watching. I love you guys. Bye!